Welcome to this clinical walkthrough on the Scleritis case for UK-MLA, brought to you by Mediate, your 24/7 practice partner.
All right, we're going to break down this OSCE station into 6 key stages. We'll cover everything from how you walk in the door to how you wrap up the consultation. This is your roadmap for the station. Let's dive in.
Okay, those first 30 seconds are absolutely crucial in any OSCE station. Picture it. You're meeting a 70-year-old woman who's had right eye pain for a week. Your job right now? Be confident, build a connection, and tell her exactly what's about to happen.
This phrasing right here, it's perfect. You introduce yourself, check you've got the right person, and set the agenda. It puts you in control and makes the patient feel they're in safe hands from the get-go.
Now we're into the history. You need a system here. A good framework means you won't miss any of those vital clues that point you towards the diagnosis and away from the red herrings.
When you hear pain, you should immediately think Socrates. It's your best friend in these stations. For this case, you're using it to nail down the specifics of her right eye pain, that deep, aching feeling that's been there for about a week.
Pay really close attention to these associated symptoms because this is where the diagnosis starts to become clear. She'll tell you about light sensitivity, redness, maybe some blurred vision. But the absolute classic sign for scleritis? Pain that gets worse when she moves her eyes. That's your big clue.
You also have to show you're thinking about other possibilities. You've got to actively rule out other causes of a painful red eye. Every question has a purpose. You ask about a gritty feeling to screen for conjunctivitis. Asking about halos around lights? That's a red flag for glaucoma. Be systematic.
Okay, next, zoom out and think systemically. Scleritis is strongly linked to autoimmune diseases, so you have to ask about them. In this scenario, the patient has rheumatoid arthritis and is on methotrexate. You also need to ask about her ideas, concerns, and expectations. What's really worrying her about all this?
And remember, the best way to get this down is to practice. You can practice this exact case right now and get objective feedback on mediate.com.
Let's move on to the examination. In an OSCE, you have to talk through what you're doing. The examiner can't read your mind, so verbalize every single step of your focused eye exam to get all the marks.
Keep the examination sharp and to the point. Start with a general look and vitals. Then get to the eye itself. You need to inspect it, check her vision with a Snellen chart, assess her pupils, and then test the eye movements in all 6 directions.
On examination, you'll find the things that confirm what you suspected from the history. You're looking for a deep, purplish-red color on the white of the eye. We call it violaceous redness. And when you ask her to follow your finger, she'll tell you the pain gets much worse. That clinches it.
So, you've put the pieces together. Now you have to explain it to the patient. Your explanation needs to be clear, simple, and empathetic. No medical jargon.
So how do you explain scleritis? You could say something like, it's a serious type of inflammation affecting the tough, white, outer layer of your eye. The key is to then link it directly to her rheumatoid arthritis, so she understands the connection.
Here's a great way to phrase it. Explaining that it's her own immune system causing this, linked to her RA, helps her understand why it's happening. It's not just a random eye problem, it's part of her underlying condition.
You have to balance telling her this is serious with reassuring her. Acknowledge that if left alone, it can damage her vision. But then immediately pivot to, the good news is, we are acting on this right now to protect your eyesight.
All right, let's talk about the management plan. The examiner is looking for a safe, clear, and immediate plan of action. This is where you prove you're a safe doctor.
Your plan needs 4 key parts. 1. An urgent same-day referral to ophthalmology. 2. Start oral NSAIDs like ibuprofen for the pain. 3. You must contact her rheumatology team. And 4. Tell her not to drive. Ticking these boxes shows a really solid, safe approach.
This is a massive safety point. Knowing what not to do is just as important. Do not prescribe topical steroid drops. That's a jump for the specialist after they've used a slit lamp to get a proper look, because steroids can make some other conditions much worse. Knowing this will score you big safety points.
And finally, safety netting and closing the consultation. You need to give the patient clear what-if instructions and make sure she feels confident in the plan.
Your safety netting advice has to be specific. Tell her she needs to come back or go to Annie immediately if the pain gets worse, if the redness or swelling increases, or if she notices any change in her vision, especially any loss of vision.
This is a brilliant way to wrap things up. You're directly addressing her concern from earlier, confirming that yes, it needs treatment, but that you're on top of it. It's powerful, it's reassuring, and it shows fantastic communication skills.
So there you have it, a full walkthrough of the Scleritis OSC station. To really make this stick, you should practice this exact case now on mymediate.com.
And just to leave you with something to think about, you've done all the right things, but 6 hours later she calls back and the pain is unbearable. What do you do next? Think about how you would escalate her care.